Boys and girls, here we are talking today about TMD or TMJ, temporalis mandibular joint syndrome, and it manifests in many people, especially during COVID, so much stress. We have our lovely lady Jean. Hi.
Hi.
Now, what we're going to do for her today is we're going to review the anatomy of this. So if we take a look, temporalis is this muscle right here, and the masseter is right here. So TM, and then the J is the joint part. So think of it as a three-headed beast. This is the muscle, that's one. The joint and teeth, that's covered by your dentist. And then the third part's the most difficult. That's our stress. So meditation has definitely been able to help. Think of that as the gasoline that fuels the motor that drives the joint. If we can help improve this, we can diminish some of the headaches, clenching, grinding or bruxism at night. And Jean, do you have any of those symptoms?
Yes, I have bad headaches.
Bad headaches. She works with computers, so you're looking at a screen all day.
Straining
Okay. Where do you feel a lot of your tension?
around my temple.
The temples. Okay. This is a classic area. They call it tension headache. In women, migraine headache. Either way, the treatment's the same. You either take pills, or in this case, we're going to go ahead and use Botox to relax these muscles. Let's look at temporalis and masseter. And can you clench for me? There's one, there's the other. Do that again. And look, they work in tandem. And as we keep doing this from opening and closing our jaw, do that again. We'll look at the other side as well. There's temple. Look at that, impressive. Okay, this is normal. We all use this. So now, as we get older, a couple of things happen. That muscle gets wider and wider, and therefore the shape of our face becomes square. So in 3 to 7 days when we do this, it's going to relax the muscle, and gradually over the next few weeks, her face shape will get slimmer. But more importantly, she's going to feel better. The clenching, the grinding, all of that's going to be diminished. And then now, let's diagnose the temples. One of the things we try to teach our patients is about relaxation, mindfulness. And one of the ways we do it is we put our patients through a short meditation. At the same time, we're going to have her use these acupressure grips. And just like when you exercise, as you breathe in, squeeze gently, breathe out, open. Repeat, just like yoga for your fingers, and open. And then Jen, we have her here with the ice. Remarkably, this injection doesn't hurt. It is the most comfortable injection in all of medicine. I know, it's weird, right? So we're gonna prove this. As we inject this, we're gonna count to 3 when we're done, and we're gonna see if she feels relief and better. So come on in for a close-up. Let's ice this area. And then clench the masseters. Look at that, it's exquisite, beautiful. And keep clenching, clenching, clenching. And 1, 2, 3, 1, 2, 3, and we are finished. On a scale of 1 to 10, how was that?
That was like a 0.
Amazing. Okay, let's do the other side right now. Okay. Turning gently this way, and then clench for me again. Yes, right there, there's masseter. Keep clenching, clenching, clenching. Keep clenching, clenching, clenching. And we're finished. How was that?
Again, a 0.
0. Turning ever so gently this way. Okay, I'd like you to clench for me. See how it pulsates and flexes here. Okay. Now Jean, when I press here, it's supposed to feel like that. Does that hurt?
No.
Okay, now watch, clench. Does
Well,
that
that hurts.
Okay, keep clenching. What we're doing is we're trying to figure out all the points of tenderness. It goes all the way from here to here.
Okay, that hurts.
That hurts.
A lot,
Okay,
yeah.
a lot. Did you hear that? So this is where temporalis is really tender. These are her triggers. Clench, clench, clench. Okay. Now watch this. This is where the magic happens. We're gonna poke her many times.
Here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 times.
Okay, Jen, you ready? Can I get the magic wand? Can you count for me?
1, 2, 3.
How does that feel?
I actually do feel a little relief. Actually, yeah, I do. Yeah.
Isn't that amazing?
Yeah, that's pretty cool.
So the idea behind this is, think of these muscles as constantly flexing and holding up your world like Atlas. But these muscles are holding up Jean's world. And what we did temporarily is relax the muscle. This will go on for about 3 or 4 months so that whenever she's stressed in this area, we broke the band that causes a squeezing tension headache. And I think this is a much better way to treat our patients than to take pills. Sorry, Big Pharma, I know you don't like that, but I think that this is a life-changing treatment. I've had it done, and Jen,
I've had it done.
how do you feel about that?
Best thing ever. Yeah.
So we'll stay tuned. Okay, so we just finished the injection on both sides. Jean, how do you feel?
I feel it feels so much more relaxed, and I do feel a lot more relief. You know?
This was your first time.
Yes, very first time.
Were you a little nervous going in about all the needle pokes?
I wasn't, because I totally trust you.
Oh my gosh, so kind of you. I think a lot of people, if they knew we were going to inject them 20 times with a needle into their temples, it would scare them. But now that you've done it, did it hurt?
Not really, no.
I know, it's fascinating. I think the tension and pain in that area is so enormous that the needle itself, they hardly feel it. And then once it goes in, it sort of forces the muscle to relax. And how does that area feel right now?
It feels really good, actually. It feels a lot more like relaxed.
It's amazing. So for any of you that have TMJ or headaches, you want them to go away and find a safe alternative while also slimming the face over time. Maybe Botox in this area could be for you. So we'll post some after photos of her in the weeks to come.